Occasionally, passing by the houses, we happen to look up in the window, wondering about the lives of our neighbors. There are different houses, poor and rich, private and state, libraries, shops, hospitals. We don't know why, however, but when we are walking by the hospitals, we prefer not to think about what is going on there, behind the window. We look at the grey window and curtains quickly and stop our glance at blue medical lamp. We are so afraid of our relatives to be there in the hospital, and God, please, don't let our children get ill. But overcoming our fears, we realize that the hospital is a place for cure, help and relief. We need them. There is also its soul, life and story. It was founded at the beginning of the 20th century on money on the wealthiest Yekaterinoslav tradesman, Ivan Alexeyenko. Unfortunately, Ivan Alexeyenko and his wife could not have their own children. Therefore, they gave their own money for the needs of other children. He generously contributed money to the city female gymnasium and commercial college. After his death, he left to the city all his money and large territory in the center for the building of the hospital. Last will of the respectful tradesman was implemented. The hospital and the hospice were built on the land left by the tradesman. Hospital was built for 50 patients only and was named after him. It was the first children's hospital on the south of Ukraine. Russian Emperor Nikolai II was on the opening of the hospital in 1912. During the Soviet periods, the hospital went through a number of transformations. However, today, little patients are still cured and treated in the hospital, built on the money of Alexeyenko. For the time of hospital's existence, 90 years, several generations of doctors worked here. According to the changes of the society, people and attitude towards them also changed. Maybe both political and economical situation, medical policy of our government led to the situation when in hospital only truly committed and devoted people work. People who would come here even in case if they were not paid for their work, because they can't live without it, because their destiny is to save lives. First days of the life are the hardest. Baby's organism adapts to the new environment. It is a difficult period for healthy, full-term children, and that can be an insuperable barrier for the preterm baby. This baby needs help of doctors, qualified treatment, modern equipment and medicine. Sometimes doctors' minute delay can cost baby's life. First neonatal intensive care department in Ukraine was opened here, in Children's Hospital No. 3, 20 years ago. It was hard to begin. Doctors had to search and translate international scientific articles themselves. They had to invent, again, well-known in Europe methods. They had to develop new scientific approaches for treatment. They learned a lot for those years. Learned how to save lives, how to overcome disease and win time. But to overcome the indifference and deep poverty in medicine is impossible, even for the most talented people. Today, there are only 12 intensive care working places in the only regional department, specializing in treatment of preterm babies and sick neonates. What should a doctor do if there are more little patients than intensive care working places? What if someone's baby is the 13th? Life of such baby can be saved with the help of 50,000 euros. This is the cost of one intensive care working place. Today, there is no possibility to buy it on financial resources of state budget. It is impossible to buy not only equipment, but also a lot of other necessary things. Government gives 1.5 hryvnias, 20 euro cents, on the treatment of one ill child per day. 1 ampoule of surfactant, necessary medicine for the opening of undeveloped lungs, costs about $500. There is no reason to mention about doctor's salary. Nevertheless, 24 hours a day, without any holidays and days off, all possible efforts are taken for the saving lives of our children in neonatal intensive care department in Children's Hospital number 3.
Есть другой ребенок, который родился, которому нужна помощь.
Now it is great lack of incubators, monitors, ventilators, operational tables, warmers, surgical instruments and supplies, X-ray and MRI equipment. Lack of equipment for intensive care makes doctors to deal with the problem of choosing what children to provide with equipment on which their lives depend and what not. There is only a certain amount of equipment doctors have in their hospitals to satisfy high demand. The success of doctors in curing birth and acquired abnormalities is well known not only on the territory of Ukraine, but also beyond its borders. People from different corners of our country ask them for the help. Little Victoria was born with a birth abnormality, cloacal malformation. Instead of separate, she had common outlet for urogenital and bowel systems. After 4 months of treatment, girl went home without her terrible abnormality.
Мы попали уже после Москвы, там нам просто отказали.
We came to Children's Hospital number 3 after Moscow Hospital, where doctors couldn't and refused to help us. And we came here and received immediate help. Nastya also came to Dr. Makedonsky from other region. They went through a number of difficulties during her short life. At the age of 2, she had open heart surgery. They came to Dnipropetrovsk with the hope to cure another birth abnormality. Nastya didn't have bladder. Girl had urinary bladder agenesis. Time spent in Kiev hospital didn't bring any results. In the Children's Hospital number 3, within the half of a year, 2 very difficult surgeries were made. First stage of surgery was to create bowel reservoir. Second stage, ureter's reservoir implantation with continent catheterizing stoma formation. Young patient and doctors were satisfied with the result of their work. They managed to give this child long-expected relief, especially regarding the fact that it was 6th known case of bladder absence in the world medical literature. We have tremendous growth of congenital malformations and birth defects in addition to general birth-reduce ratio in Ukraine. Because of these factors, we had to improve our professional skills and knowledge. All those kids you have seen are very unique. They are unique for their parents. They are unique for the doctors. The nature is so differential that each birth defect greatly differs from each other and requires specific ways of treatment. In Europe, there is a special team who work for special treatment of rare birth defects. But now we are also have good experience in neonatal surgery. And now we can be proud of the results we show. The proof of this is great interest of European and American doctors. Due to the lack of medical equipment and medications, we must divide operation procedure in several stages to avoid operation, death, and severe complications. Words can hardly express gratitude and happiness of parents when they understand that their child is not hopeless anymore. They are grateful to the doctors who gave their child not only health, but also hope and faith. They believe that their family is not fated anymore, that once they could have grandchildren and life is full of things which are worth living. This baby is only 19 weeks old, but he has already suffered 2 surgeries. He wasn't given a name yet. His parents has another, more important things to think about. The baby was born with terrible diagnosis, gastroschisis. He survived thanks to professionalism of doctors of Children's Hospital number 3. Fortunately, such abnormalities have been treated with 100% success for the last 4 years. But still sometimes there is no possibility to help a baby because of technically old equipment and scarcity of medicine, as well as number of other factors that shouldn't exist in the country where the quantity of luxury cars impresses even foreigners. Country where real estates cost millions of dollars. Country there are still people that are not indifferent to the sufferings of others and prefer to spend money on saving lives rather than to buy new luxury car. Dear new tradesmen and patrons, what would be left after us? What our children will tell about us to future generations? Time will show. Wish they could tell that their grandparent spent his money worthily, saving someone's life.